Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. Welcome to this week's episode of the Healing Pain Podcast, the show where we explore the dynamic world of chronic pain, neuroscience, physical therapy, and the opportunities for transforming how pain care is delivered. I'm your host, Dr. Joe Tatta, CEO of the Integrative Pain Science Institute, where we train physical therapists and other practitioners on integrative whole-person pain care. Joining us today is Dr. Ericka Merriwether, a distinguished expert in the field of physical therapy and pain neuroscience. Dr. Merriwether is an assistant professor of physical therapy and medicine at the prestigious Steinhardt School of Education, Culture, and Human Development, as well as the Grossman School of Medicine at New York University. She earned her PhD in movement science from Washington University in St. Louis and her doctorate degree in physical therapy from the renowned Mayo Clinic School of Health Sciences. To further hone her expertise, she completed a postdoctoral research fellowship in pain neuroscience at the University of Iowa. What truly sets Dr. Merriwether apart is her commitment to exploring the intersection of weight, race, and chronic pain. Her research delves into the mechanisms of chronic widespread musculoskeletal pain with racially and ethnically diverse patient populations. Her goal is to identify culturally appropriate, personalized targets for pain management. In today's episode, Dr. Merriwether will shed light on the fascinating connections between weight, race, and pain, and offer insights that have the potential to revolutionize how we approach pain management and improve the lives of countless individuals. So whether you're a healthcare professional, a patient dealing with chronic pain, or simply someone eager to learn more about cutting-edge developments in pain science, this is an episode you won't want to miss. A big thank you for joining us again this week. And without further ado, let's dive into this captivating conversation with Dr. Ericka Merriwether. Hi there, Ericka. Thanks for joining me this week on the Healing Pain Podcast.
Thank you for inviting me. Great to be here.
The topic of obesity is one that we hear about every day, right? In the media, it's obviously in our professional education as healthcare professionals. The public is aware and concerned about it. And probably within the last maybe 5 or 10 years, you'll catch us up on the research. But the topic of obesity and pain perception and health and wellness promotion, those aspects have started to show up in the physical therapy literature. So I'm excited to speak with you as an assistant professor at the NYU Department of Physical Therapy. You teach there full time, but you also are a pain researcher. Tell us how you began your career and where your interest lies in pain research.
So thank you for the question. A lot of my experience was born out of really wanting to optimize movement, first in athletes and then in people who were not athletes. And so I've been in this space since my sophomore year of college or undergrad. But my interest in pain was actually born out of a recruitment from my PhD program in movement science at WashU. And I did not have experience with pain beyond what I'd learned in my physical therapist education. But once I was involved in a randomized controlled trial of TENS, which many of us use as a pain control mechanism in our practices, better understanding, how to use TENS, but also pain pathways and potential mediators of pain, and really the universality of the experience of pain. I haven't met a person yet that hasn't had a pain experience. I think all of those things really solidified my research and personal interest in understanding the pain experience and factors at the individual to the macro level that influence that experience, and to better inform rehab practices.
I know some of your early PhD work, you worked with Kathleen Sluka, and you mentioned on some of the TENS projects. Is that right?
So that was in my postdoc. So yes, Dr. Sluka was my postdoctoral mentor. And so I, my role in her lab was to work on a randomized controlled trial of TENS for movement evoked pain in women with fibromyalgia. Um, but I also had a role of uh, a basic science project to look at immune system factors that were related to some of the clinical outcomes that we measure as physical therapists. So I had a wide range of experiences in that lab, in Dr. Sluka's lab.
And that's been a number of years now. How has that changed, and what's the focus of your research today?
So I do draw on a lot of those principles that I learned in my postdoc, but I've really used or leveraged that to focus on the pain experiences, particularly of folks who are race, Black or Hispanic Latino. That was kind of a natural transition just based on some of my advocacy at the time for patients and scientists who are underrepresented in a lot of these spaces. But I was quite resistant to actually making that the focus of study. We can get into that another place and another time. But I think, well, I know the 2020 uh, pandemic and the events surrounding the murders of George Floyd and Breonna Taylor and uh, really forced me to reevaluate my values and how to align my research with my values. And so um, that is how I've developed this independent line of research I'm doing today.
Hmm. Sounds like that experience that we all went through, but it helped you kind of niche down and focus as far as a research area goes. And oftentimes they tell people when you research, you should really kind of focus in on, a topic that um, is obviously new or novel, or one that could have an impact on society.
Yeah, and I don't think that I strive for novelty. It just kind of happens because people aren't asking the types of questions that I'm asking. And a lot of those questions are informed by people who with lived experiences with this intersection of having a racialized identity and having an obesity identity as outlined by the World Health Organization. And so I don't I recognize my positionality as a person who lives in a Black woman's body, but I don't necessarily live in a fat Black woman's body. And I think it's important, or a Hispanic woman's body. And it's important for me to acknowledge that positionality because it helps me center the voices of those who do and what types of questions are impactful to them, which I think we all at least say we want in the physical therapist space and other healthcare spaces.
Hmm. So I appreciate how you start to mold and shape your career kind of around these, one, an awareness of social determinants, and two, how can your research have an impact on social justice? Where did the kind of the obesity part come into that?
Yeah, great question. So that actually started in my postdoc. When we were doing the 10 study, a lot of the participants, like 60% of them, would be classified as obese by the World Health Organization. And so this was around 2014, 15. We were asking questions about, this overrepresentation of folks with BMI in the obesity range. And we were just looking at our data and looking at the literature that was fairly sparse at the time on, why this comorbidity existed. So that part started before the intersections of race and gender in many ways kind of happened that I'm doing today.
So I want to start to, there's obviously a lot of components here that we've already started to just kind of mention, right? And all these things are starting to intersect. It's intersecting in your research. And of course, it's intersecting in the clinic. And as you mentioned, for people's experience of pain specifically. So I want to start to kind of dig down into some of the details and share with us, what you know about. I think probably the maybe foundational place for us to start, since this podcast centers around pain, is let's start here. How does weight impact someone's pain perception?
So that question to me was less loaded than it is today. um, and so there are a lot of layers that I'm still learning about, but at the base of that pyramid, if you will, is, are there intra-individual factors like biological factors, which I see a, proliferation of work around, inflammatory biomarkers of both conditions, psychosocial comorbidities associated with both conditions. So I think that people are trying to, researchers, myself included, are trying to look at some of those intra individual factors. Um, there are interpersonal factors to consider, the relationship that the patient has with their supports, their social support system, if they have one, um, and the interaction that patients have with their providers. Um, and so how, and I think that's particularly relevant for physical therapists, because it really speaks to, you know, the shared decision making process. Um, and then there are these macro level factors, barriers to access to pain management, barriers to access to forms of weight management, stigmas and discrimination that folks encounter, either in the healthcare system or just in society in general. Not having access to fashion. We live in New York. We all want to look fashionable at some point anyway. But having access to, cute fashions, or having to, not have a lot of space to sit on public transportation or planes or things like that. So, there are all of these things that converge to make a pain experience for a person in a bigger body, or that augment that, or make it worse in many ways. And so I'm just trying to better understand at these different levels how that's happening.
So living in a different body or a bigger body than society is, let's say, prepared for, or is educated about, or has learned to destigmatize, can have an impact on someone's pain experience. I think the idea of the, um, an adequate size seat, so to speak, which you hear about nowadays on the news, things like planes and trains, is just interesting in and of itself, because people don't think that that one factor, right, that one social factor could have an impact on someone's pain experience. Can you kind of maybe tweeze apart that just a little bit? Like, how does the size of the seat potentially affect someone's pain?
Yeah. Because it's not obvious, but I was at the San Diego Pain Summit in February. So shout out to Dr. Moscuto who said this, and I totally agree. When you go to a healthcare provider's office, um, just how it looks sets the tone. So if you are in a bigger body and the seats are small, and there's no opportunity to have seating that accommodates your body, that sends an unintended message that that person's not welcome there. And so if everything is built for people with smaller bodies, then folks don't want to be there. They don't trust that you have them in mind when you're trying to come up with a shared plan to intervene on whatever it is they're there for. So the types of paintings or art that you have, if you even have art in there, do they depict people that look, like the range of bodies that we have in society, or are they skinny, rich white folks? And so little things like that could make a huge difference in terms of developing and maintaining trust with our patients who have these experiences.
So the so-called centers of healing that we have in our society haven't necessarily considered different body shapes and sizes.
I mean, I can't speak to it since I haven't been there, but if the seating is not appropriate, and not just for folks in bigger bodies, but folks with disabilities, things like that, just considerations for all types who could potentially become patients or participants in that healing institute or whatever. It's important.
Right. So, and as practitioners listen to this, it's a consideration that when you look at your office, your clinic, whether it's a physical therapy clinic or other clinic, is that environment, or have you taken into consideration that that environment is set up for different types of lived experiences, basically?
Absolutely. And the treatment, even the treatment tables or plinths, are they adjustable? Can they accommodate, you know, folks in bigger bodies, or do they have a weight limit of 200 pounds or something? I consider them small changes, but these are changes that could, make the space more welcoming and inviting to prospective patients.
A lot of these fall under, the social context, right? So the context that someone's moving in and out of, and a lot of these have to do with social factors, social determinants of health. What does the research say regarding, let's say, the depth of the impact of social determinants of health on obesity versus, let's say, you know, just the biological factors like metabolism or just the psychological factors like depression?
Yeah, so I don't know if we have enough time to go into all of this stuff since it's been a pretty rapid proliferation of the conversation of social determinants of health in the pain space and in the physical therapy and rehab space. But what I will say is that there's some very smart people that I know in the pain space and the rehab space that talk about how these social determinants affect the physiology of pain and whatever other health conditions we are treating directly or indirectly. And so, um, understanding, so the determinants of health, for those who may not know, um, economic stability, education access and quality, healthcare access and quality, the neighborhood and built environment, and social community contexts are things that impact the pain and rehab response to interventions or assessment, and how we view and how people view their pain experience. And so I think that understanding that a lot of what we're dealing with as physical therapists doesn't happen in a vacuum is important. And I think there's an increasing recognition of that in the literature. What I hope is happening is that that is playing out in our, one-on-one or group interactions with patients on the ground. I hope I answered that question adequately.
I think you make a really good point because right now there's, as you know, the word biopsychosocial is just everywhere, and for some reason, I think to a certain extent, our profession has kind of, instead of clinging on to the social, they've decided to cling on to the psychological first. And I think it
Yeah.
fits with I think it fits with our history as a profession, meaning we like to identify, label, and, you know, resolve, cure, fix, fill in the blank, where it's a greater challenge to necessarily do that with the social determinants of health, but still keeping these into consideration. in your evaluation, in your treatment, in psychologically informed care and trauma-informed care can have a profound, although sometimes at times maybe not as easy to measure impact. Do you think that's all fair assessments with regard to people who have pain and or weight challenges?
So you said a lot there, and a lot that I agree with. And I guess I never thought about it that way until literally just now. So thank you. Because I did think about the psychologically informed care and why there was such a rapid uptake of that compared with the social determinants of health, and our proclivities to want to fix and cure, because that's very much still within the medical model of health and, dare I say, wellness. Um, and that we've been talking about social determinants of health, but we haven't even talked about the political determinants of health, which is a emerging model, much like the social determinants of health, but it really talks about the social drivers at the legislative levels that impact the social determinants of health and all of the other things we've been talking about. So, and it seems intractable. How do you deal with racism? How am I supposed to deal with racism as a clinician, right? Um, how I'm not going to cure racism. um, and so how do I intervene on stuff like that? And I think it also forces questions of where do I sit in my awareness and acceptance of all of this stuff? Because a lot of this is new knowledge for physical therapists and other clinicians, and not so much for others. And so thinking about this in terms of our patients, um, particularly patients with lived experiences with pain, obesity, and a host of other comorbidities, I think it's relevant to at least ask about social supports, um, access to things, because that impacts the intervention plan. And so, not addressing that and not thinking about your own biases, because we all have them, or blind spots, because we all have them, um, I think is doing our patients a disservice. So having safe spaces or brave spaces to have these conversations among ourselves and with patient advocates and policymakers, I think could really open up a discussion as to how we can embed these things into our physical therapist practice and really update our practice guidelines to include this stuff.
As a professor, what do you see the role of a physical therapist with regard to the care and management of obesity, knowing that it oftentimes does intersect with weight management?
We said off camera, I'm fairly new to the weight management space in terms of seeing how healthcare does that, particularly primary care or bariatric surgery, which is what the space that I'm in right now. Um, but I see a tremendous opportunity for physical therapists to understand what the weight management options even are and how eligibility is determined for said weight management options. We're seeing a lot of discussion around medications such as Wegovy and things like that for weight loss, and that's come out in the mainstream. And I think we should really educate ourselves on what these medications are, because people are increasingly seeking them out or are being prescribed based on whatever the criteria are. Um, Bariatric surgery, lifestyle weight management, who goes in the pipelines for these things. But I think I say that, and yet that's a lot to put on physical therapists to do that themselves. And so maybe the future is having some kind of additional education or specialty, much like we do with, neurology or orthopedics or something that really focuses on how weight management actually happens, because it's much more complex than I thought. Who goes into this weight loss or weight management, pipeline versus this one, and what goes into those decisions are really just beyond the physiology of it. It's also, can your insurance cover it? And, do you have access to, the tools for remote support, nutritionists and all of that stuff. So I think that physical therapists are would be valued in these spaces because we're not in these spaces right now. Um, and
Well, that's important right there, that
we're not.
we're not
Eh,
in these spaces. And I think when you look at one, the amount of people who have obesity, to
yes,
the comorbid disability and physical impairments that may be occurring in those spaces, right?
yes, which are not very well addressed in weight management spaces.
Yeah, and then because I'm imagining that at some point they're receiving advice on exercise and physical activity, but we all know it can be very difficult to engage with exercise and physical activity when not only that you have extra weight on you, but also that weight itself is potentially causing an impairment, which is impeding with your ability to begin an exercise program of some sort.
Yeah, I think that people now this is just, me walking around New York, and this is, and in the spaces that I'm in, talking with people. I think people that live with lived experiences with being in a bigger body, particularly if you are raised Black or something, indigenous or something like that. I think the messaging around wellness is much better received than the messaging around imminent death if you don't do this. Um, and really having a say in how that discussion even goes. Is pain a problem? And if so, how? Do we want to talk about the role your weight plays, or do we assume that if you're in this weight management space, you and your doctor got it? We can talk about the movement and function, because that's what we can offer to you as physical therapists. I think even starting there is very important, because before we launch into, well, your BMI is high and that's a risk factor for dot dot dot. It's like, okay, losing weight is not, something that happens very quickly. So what can we do now to maximize my function, engage in physical activity, which a lot of people want to do? Like, there's this assumption that goes with the stigma of laziness and all of that, even though obesity's been medicalized. But how do we as physical therapists, and we've been grappling with this as a profession for a while now, what's our role in the wellness space, particularly promoting physical activity as medicine? I
Mhm.
think that there's a ton of opportunity for us in these spaces that I'm occupying, but also in our practices as they exist now, injecting these types of changes in how we converse with folks who live in bigger bodies that have pain.
I appreciate the shift, or helping all of us shift from what's wrong, what's the pathology, to wellness. And we're talking more about a term that I'm bringing up called salutogenesis, which is the movement toward health and wellness, as you mentioned before, that oftentimes that message is one that people are more ready to receive. How do I become well again? Right? People know there's something wrong. They know that this is hurting. They know this is not right. They know they have some extra weight on their body. Okay, how do I move toward living a vital, well life? And that health and wellness promotion sits squarely in our scope of practice. So, of course, talking about physical activity, yes. Talking about sleep promotion, talking about the avoidance of risky substances. All these have a stress management. All this can have an impact on potential mechanisms in someone's either pain perception or that may be contributing to the experience that they're having around obesity and or pain.
Absolutely. And, that's not to say that we have to take ourselves out of the tertiary care space, because we're still, very much needed there. But we are primed to even be, in the referral space. So I think some of these wellness things that we've been talking about are becoming more and more mainstream,
Mhm.
uh, particularly in popular culture. Um, and I think that we can capitalize on that as physical therapists and promote, be in the health promotion and wellness space with these, social and political determinants in mind, and these identity um, these identity related um, issues in mind, so that we're giving the best advice that's tailored for what our patients need based on and meeting them where they are.
How is a good socially informed physical therapist who understands the intersection between pain, obesity, and one's experience who is a person of color? How is that good for someone's mental health in their healthcare, so to speak? So, a physical therapist that understands the intersection, the interrelatedness between pain, weight, and someone's skin color, let's say, how does that improve, or where's the potential there to improve someone's mental well-being?
So I think that acknowledging that that intersection exists start is a great start, um, because everybody who has a BMI in the obesity range is not experiencing pain the same, is not experiencing healthcare system or the context in which they're operating the same. And so just acknowledging that and not necessarily asking, hey, did you experience racism today? Because people might not be comfortable asking that question, but understanding that um these experiences differ based on a lot of these identity intersections and how multiple systems of oppression can converge to make that pain experience worse on pain, and thus mental health is important. I think understanding that a lot of these, you know, psychological comorbidities, like anxiety, depression, and things like that, underlie both conditions. And so if you're addressing the pain, which is in our wheelhouse right now, it's comfortably in our wheelhouse, I would like to think right now. You may be affecting these other comorbidities, right? Without necessarily directly, you know, measuring the improvement in those comorbidities, or tracking those improvements. You may be affecting them. So I think those are a couple of ways that clinicians can think about how to impact or to create a positive experience that could help mitigate the effects of a pain experience. I hope that answered your question.
I think it's well said, and I think it obviously speaks to the work you do. I know you have a couple of grants and projects already that are in the works, so we're all interested to see what the outcome is and what kind of new information will be delivered to, of course, not only people with health conditions, but also those of us that treat them, i.e., physical therapists, especially because you're going to embed this into the program, and obviously your research will help inform what we do as physical therapists, both in the DPT curricula as well as in the clinic.
We're just in the early phases of understanding mechanisms of pain and how they respond to weight loss. We're using a bariatric surgery as our weight loss model, particularly in those who are race not Hispanic, Black, or Hispanic Latinx. And so for this study, we're just interested in understanding how some of the, some of, well, we're looking at chronic widespread pain. And so some of the features that we associate with chronic widespread pain, which of those features are active before and if they change after surgery. And it's really just about understanding the role of weight. And so if you can manipulate weight in this dramatic way, what is it that we can focus on in terms of pain management at these different stages of weight loss or weight regain or whatever? That's what we're really interested in, to set the stage for thinking about how to support folks with their pain management, no matter what their weight is or where they are in the weight management phase. And so I feel like I need to understand better what's active when, and how weight influences pain physiology, and how the context in which this is happening plays a role in that. And so I'm excited. It's daunting because we're getting started, and I'm always nervous. It's like, oh, who are you able to recruit and keep them in, and all of the things. But I hope that what informs physical therapy is, what is the actual role of weight? And should we intervene and support with weight management, and when, versus pain management? Like, that to me is the most important potential contribution of this particular project.
Let our followers know how they can learn more about you and stay abreast of your work.
So I am on X, formerly known as Twitter, at Merriwether, all lowercase. I'm also on LinkedIn, and I also have a profile on NYU Steinhardt's website. So those are 3 ways in which you can find me.
Great. So I want to make sure to point all of you to those resources. Those links will be available on the webpage here at the Integrative Pain Science Institute.com. Just go over to the tab for podcasts and you can find this episode. I want to thank Dr. Merriwether for being here this week, talking about the intersection of pain, obesity, and social determinants of health. Make sure to follow her on her LinkedIn, as well as you can find her at NYU, which is New York University, at the Doctorate of Physical Therapy program. Make sure to share this episode with your friends and family on your favorite social media channel. I thank you for being here this week, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.